Hi, my name's Graham DeGoldie. I'm the Director of the Melbourne Institute of Massage Therapy. With me today is Dr. Carl Ridgway. Carl's our Senior Lecturer in our Diploma of Remedial Massage, our Advanced Diploma of Remedial Massage Myotherapy courses, as well as our postgraduate courses. Carl's an osteopath, has a successful practice in North Carlton. He lectures primarily in our clinical assessment, remedial massage techniques, as well as advanced techniques within our advanced diploma course. He lectures for us and also does some courses for the Massage Association. He's a well-respected lecturer, and today I'd just like to do a little bit of a refresher for our students who have completed the diploma and advanced diploma course. Carl, from a practitioner's point of view, what are the three most important things a practitioner should look for when doing a standing postural analysis?
Okay. Some of the things that I tend to look for, specifically as when the client's coming through the door, is exactly how they're presenting. So how they're walking, how they're moving. But as they come in, how they're standing specifically. Like the very first thing that you see, the thing that jumps out at you the most, is something to consider when you're going on to do your treatment. So you take that as a clue to how you want to then go about your diagnostic techniques. So as a lead into what you want to do next. So that would be the very first thing that I want to take into consideration. From there, the thing that I do the most with regards to assessment and what I teach in class is looking at both the vertical structures in anterior, posterior, and also both right and left sides.
Okay. And
seeing how the client lines up in the vertical structures. So we're looking at the anterior position of the anterior portion of the lateral malleolus.
Yes.
The middle portion of the knee.
Yep.
The hip joint, greater trochanter basically. Looking at the shoulder, acromion is a good place, and looking at either the mastoid process or the external auditory meatus, and looking at that as our vertical guide. Okay. So that's two.
Yes.
And then three, horizontal structures. So looking at shoulder heights, looking at pelvic levels, and considering the position of those in how the person is standing. Tying them all together can give us a very good overall picture from just in the standing posture, which can lead us then into our assessment technique.
Beautiful. So from a practitioner's point of view, that initial consultation and postural analysis will send them on a path of what treatment protocols they should be taking.
Most definitely. It's always that first part of the assessment, looking at how they're standing, how they're moving. If a person's standing and they're leaning to one side, it has to guide you as to what this person's presenting with. Even if they're saying that they've got a sore shoulder and they're leaning to one side, we have to consider that, and our assessment then is dictated by that and guided.
Right. So is there any one thing that is something that we should really be aware of in regard to the treatment plan that we would be looking at? For example, you talked about someone having a sore shoulder. So if they came into your clinic and they were side bent, does that indicate that's the first thing you should be looking at? It's a hard question.
It is a hard question. Thanks for throwing that one to me. With regards to that, it's guiding us. The more experience that you have with treatment, the more experience that you have with your visual assessment is going to help in terms of where you start. But if someone is, as a guide, what is happening through the pelvic girdle is a big clue to where I start.
Okay.
So if there is a definite side bending, then I want to look at the lower extremity in that standing position and assess from that point on.
Well, that's really good. That was Dr. Carl Ridgway. Carl's a sensational lecturer. Again, to any of our past students who want to look at coming into one of our classes and renewing and reviewing what you've learned previously, give us a call. Our phone number is 03 9455 1926, or email us at info@mimt.com.au. And I'd like to very much thank our senior lecturer, Dr. Carl Ridgway. Thanks very much.
Thank you.